I've heard from a lot of parents all across Ontario, all across Canada, who are frustrated at how long schools were closed in this country. They're glad to see them reopen, they're celebrating it, but they're nervous that schools are going to be closed again. Because there's still a lot of fear-mongering chatter, a lot of scapegoating of children going on out there, despite the fact that pediatricians in Canada are increasingly stepping forward and saying, even if there's a third wave in Canada, even if community transmission rises, do not close the schools again. Over 100 medical experts, many of them top pediatricians, saying just that, pointing out that while coronavirus is much more serious than influenza in, say, the elderly, it's actually less serious than the flu in children. That's not me speaking, that is top pediatricians in Canada speaking. That information just isn't getting out there all that much. And I think there's one other piece of information that I really think needs to be getting out there, that people need to understand a whole lot more as we talk about what happens next. And that is the conversation around cases in schools. Now, governments actually report which schools have outbreaks, how many outbreaks they're having, how many cases, and so forth. And I think the fact that we're publicly reporting all of this every single day, which is a good thing, open data and disclosure is a good thing, that has created all of this fear-mongering. Even though you ask any public health official, and they will agree schools aren't really a big problem when it comes to transmission. It's manufacturing facilities, warehouses, industrial sites, and so forth. Those workplaces are sort of the leading vectors of transmission in communities, second to indoor close contact, social gatherings between family members, and so forth. Dr. David Williams, Ontario's Chief Medical Officer, he has said that when it comes to in-school transmission, there's been hardly any at all across Ontario. So you had schools back September, October, November, December, hardly any in-school transmission. But you say, well, Fury, I see these headlines that say this number of cases at this school, that number of cases, this classroom shut down, and so forth. What's going on there? Well, cases in schools, it's a bit of a misleading phrase. What it actually says is that people who attend the school setting have tested positive for coronavirus. So if a child gets it from their parents, or if a teacher gets it from another family member, they test positive, and that is considered a case in schools. Even though the phrase leads you to believe that it was a case sort of acquired in school. That's not what it means at all. It just means somebody tested positive who also attends school, appears in the school setting. The vast majority of those cases, as public health officials say, were actually acquired in the home, not acquired in schools. And I think all those people who are afraid of the school situation, worried about transmission in schools, I don't think that information has been made clear to them. And it's a very important key factor that I think needs to be explained to people much more than it has been.